First of all, let me welcome you to Uzbekistan. I would like to thank you very much for your time, for your care. We consider this first international COVID-19 Congress, which is held here in Uzbekistan in online, as an opportunity for many different specialists that can share with their experience. Because already now, COVID-19 problematic has shown some results, and we can see it in a scale in some time period. We can see also the results that it has already played on different disease, and combining all this information here in Uzbekistan, it will help to the Uzbekistan healthcare system to get more experience, and maybe some fresh information will help us to issue new protocols for treatment, new vision for vaccination, new vision for, let's say, rehabilitation programs. Because even 1 year ago, very few specialists arised a problematic of, for instance, psychologist problems which are caused by COVID-19 for patients.
Sure.
Because many patients, they have got problems with memory, problems with social issues in environment, let's say. So we consider this Congress as an opportunity, and having the chance to invite specialists, experts as you, just widening the opportunities to understand this problematic globally and much wider, I would say.
Makes sense.
Could you briefly share with us some information about the influence of COVID-19 to the screening programs for other disease?
Absolutely. Just to give you the background on us, so we're a nonprofit organization that we work with about 130 countries globally on viral hepatitis elimination programs. And we have a network of about 2,000 doctors that we work with in these countries. So we recently published a paper in Liver International Journal that looked at the global impact of COVID-19 on hepatitis C. So we contacted the countries, we collected the data, and then we looked to see what is the impact of a 12-month interruption in services. What we found is that COVID-19 resulted in a 40% reduction in screening, diagnosis, and treatment in high-income countries. So countries like Germany, France. But in low and middle income countries, the average was 7% reduction. So because there were shutdowns, because people were worried about going to polyclinics and hospitals, they were not getting screened. So our analysis showed that as a result of a 12-month COVID-19 pandemic, there were 1 million less people globally that were diagnosed for hepatitis C. So that's a diagnosis. But more importantly, there were 750,000 people who were not treated as a result of COVID.
And this is the worst.
This is worse. So then we use mathematical modeling to say that if you treated less people, how many additional deaths have been caused? And we estimate 77,000 deaths just because of hepatitis C, because there are fewer patients that are getting diagnosed and treated. We also estimated that it is actually about 45,000 new liver cancer cases that would have been prevented, but because the patients are not going to the hospitals, because they're not getting treated. So COVID-19 has had a very, very large impact globally. Part of it is itself, the COVID-19, but part of it is its influence on the healthcare system as a whole and what it does in terms of patients not accessing the healthcare system.
Very interesting, very interesting. I think that during pandemic, everybody forgot about other disease. Everyone focused only on pandemic of COVID-19, but at the same time, other disease didn't leave the world. They are still there. So we have to fight. We have to help patients without any break. But the break that caused by COVID-19 pandemic caused so many deaths and so many problems.
Exactly. We did a large program in Uzbekistan, hepatitis B and C screening program last year. So prior to COVID-19, we screened 30,000 people in the Tashkent area for hepatitis B and C. When COVID-19 started, we had to have twice as many polyclinics and nurses to be able to screen the same number of people. So we ended up actually screening about 32,000 people after COVID-19, but we had twice as many polyclinics. So what it meant is the patients were not coming to the polyclinics as often. So we had to have more polyclinics to be able to find as many same patients. Now what was interesting is we were also tracking if the patients were going back and refilling the prescriptions. After COVID-19, we saw an 80% reduction in refill rate. Patients were worried about going outside the house, they were worried about going to pharmacies. The issue is that they were not seeking treatment. Again, COVID-19 by itself is very, very problematic, people getting sick, but its impact on viral hepatitis infected population was massive in Uzbekistan.
I agree with you, and thank you very much for arising this question, because it will be very much useful for the wider understanding of the influence of COVID-19 in the healthcare system generally.
Now, there has been some positive outcomes, so we should actually recognize the positive outcomes as well. Globally, we would have never screened so many people if it wasn't for COVID-19. So if I went to a country and I said, you need to screen 100,000 hepatitis patients, impossible. COVID-19 showed us is you can screen large numbers of people in a short amount of time. So if the governments are motivated, they will do screening. The other was that there was very little PCR capacity in countries.
That's true.
And as a result of COVID-19, the PCR ability to do PCR tests expanded in every country. Every African country now has a PCR machine for the COVID-19. Once this pandemic goes down, then we'll be able to use the same instruments for
Absolutely. Absolutely. So you're absolutely right that every problem has its disadvantages for the healthcare as well as the advantages. From the information that I got is that Uzbekistan has got a lot of medical equipment, PCR machines. We have increased the quantity very much, and in general, when pandemic, as you said, will be finished, it can be used for other screening programs. Great. Thank you very much for the opportunity to have this discussion. And once again, welcome to Uzbekistan. We're always open for any kind of new ideas, new scientific experience. So we welcome you and thank you very much, sir.
Well, I want to thank you and the Uzbekistan healthcare system for everything you do for the patients. I think as an insider, when you look, you always think, oh, this could be done better and this could be done better. But as an outsider, when I come and look at it, all I see is how many things are being done well. When I came into the airport, there was COVID-19 rapid test on every passenger that came out of the airplane. There is incredible capacity in testing. I know there's a lot of frustrations, but as an outsider, when I'm looking, I see all the amazing things that what my students do. So congratulations.
Thank you very much. You know, I can share with you my reason, my motivation. How did I come to the idea to start up this new Congress dedicated to COVID-19 problem in Uzbekistan? I think that COVID-19 pandemic now related to everybody, absolutely. And in Uzbekistan, I understand that we need as much as possible getting more information from scientific, medical specialists to be more experienced, to be more educated. But at the same time, I think that Uzbekistan nowadays, and during these critical moments, has implemented very efficient policy in terms of answering to the pandemic critical situation. Because the speed with which all these COVID centers that were arranged from zero, from nothing, so the speed of doing this was incredible. And I think that the experience that Uzbekistan healthcare has shown is really something that we can share as an experience, as a positive experience to the neighboring countries, to other countries of the world. So this is something that we can share as well. And I'm very glad that the Ministry of Healthcare, Mr. Kokachalov, the Minister of the Healthcare, has supported our proposal to arrange this COVID-19 Congress. And I'm sure that this event will help a lot of specialists to get much more information, much more knowledge, and much more experience.
I fully agree with you. If somebody would have told me in January of 2020 that you could create quarantine hospitals and quarantine patients and immediately tackle such massive problems, I would have said impossible. But following the news in Uzbekistan, the reaction was instantaneous. It was quite impressive. So again, my congratulations to the Ministry of Health and all the work they did.
Agreed. Thank you very much, sir. It was very nice to meet you. And once again, welcome to Uzbekistan. Thank you very much, sir.
It's a pleasure to be here. Thank you.